Welcome back to the Wellness Doc's latest info on how you and your family can achieve optimum spinal health and wellness. Listen and find out about taking your health to the next level. You too can live life, perform at your best and be well. Now here's the Wellness Doc, Dr. Ben Cardoso.
This really scares me. I've been a chiropractic practice now for 21 years, and over this time I've seen some horrible spines that truly belong in Ripley's, believe it or not. One of the worst conditions that can affect current and future health of an individual is the loss of normal neck curve. You see, the normal neck curve forms part of an arc, with the angle created from the second top vertebra in your neck to the seventh vertebra in your neck being somewhere between 35 to 42 degrees. This top vertebra in the neck should sit directly above the bottom vertebra of the neck. This shape described above means the head sits perfectly balanced on your shoulders and that a beautiful symmetrical arc is formed between those two vertebrae. This arc allows for shock absorbing during daily activity and performed perfectly to carry the spinal cord. The cord is relaxed when it runs in this arc shape. A relaxed cord means better nerve transmission of impulses, and better nerve impulse transmission means optimal functioning cells, tissues and organs in your body. Over the years in practice I've seen many adult patients with the loss of normal neck curve, with angles in the neck as low as 10 degrees. Shockingly, some even have a reversal in the neck, with angles as low as minus 10 degrees. In most cases, we also see a forward head position of the head in the illustration that you'll see just above here. More and more over the last 5 years in my practice in Mt Eliza, I've seen an increase in the number of children to our practice with this condition. I believe there is something to blame, and it's technology. Phones, iPads, Nintendos, Game Boys, laptops are all forcing our children during their developing years to adopt a habit of forward head posture. Well, what to do? Firstly, restrict the total amount of time spent using these devices. Secondly, limit the amount of continuous time spent in one sitting to a maximum of 20, 30 minutes at a time. Of course, encourage physical activity. That helps stimulate better posture. And then when using devices, adopt just generally a better posture. Lastly and most importantly, get your spine checked by a chiropractor. Children have to have their spine checked. This condition is serious and will have an effect on the future health of your children. And in today's age, it's going to be hard to eliminate. But some of the simple steps we've talked about above may help limit the effect. You make your child's dental health a priority. What's stopping from making your child's spine and nerve system a priority? Live life, perform at your best, and be well.
You've been listening to The Wellness Doc, Dr. Ben Cardoso. Want more optimum health advice and inspiration? Head to mornpenchiro.com.au.